I have to tell you, I'm not really an
Yeah.
expert on bone marrow, but I do know what chemotherapy does is it attacks, what it does is it attacks the good cells and the bad cells. And what happens, the chemotherapy he's probably getting is probably going after some of the bone marrow cells.
Told him that his white blood cell count, he needs to increase it.
Right, right. But they're killing the cancer, they're killing the cancer cells and they're killing the good ones too. So they're killing sort of everything. So there are drugs that they give along with chemotherapy to help you build up your white cell count too, and your bone and your blood count, and also to help with the nausea. I mean, I hope they gave him some of those drugs, because there are some drugs out there now that will help with some of those side effects. It doesn't take everything. I mean, it really doesn't, and it's pretty bad because it's poison. It's chemotherapy is poison. It's what it does is important, and you want it to kill those bad cells, but it also kills the good cells too. So it has a really strong effect on anybody that has that. If you want, you can take my card, and I'll go back and I'll do some research. I'm going to look at some information for this lady on her colorectal treatments, because I hadn't really paid much attention to, other than surgery is usually surgery, and then possibly chemotherapy is important. But I hadn't really looked at a lot of other options for you, and maybe also some places that you could call. I know the American Cancer Society has a lot of information that you can call them to get about that. Absolutely.
There's a lot of resources out there. A lot of resources.
That's also very important, because in his case, he was like, I have to go back to work, I have to go back to work.
I know.
And I'm like, you have to take care of yourself.
Yeah.
And he's just so worried of my bills, I have to pay, my mortgage.
I know, and sometimes you can get disability too during that time. It's hard, I know, it's hard. But I know, like I said, the American Cancer Society has some information on all types of cancer, because clearly that's what they do. And there, you can access them online at cancer.org, I think is their website. And also, it's the phone number is 1-800-ACS-2345, so that, those are ways of looking for what's available. And then, the internet is good. You have to be careful, because there's a lot of information on the internet, but some of it is actually very accurate, and if you're at the websites that are, the right ones,
Trusted ones.
the trusted ones, certain websites have, like I said, the American Cancer Society, the NCI, they have, those websites have, valid information, the CDC, that's scientific information that's been proven and you can trust, I think, for, information to get back for you. Just to sort of search bone marrow cancer, sometimes it may not be such a good thing. And women do that all the time with breast cancer too, because then they get scared to death, and there's so many, I think they could stay up all night long reading everything you can about, colorectal cancer or any kind of cancer, because it's very frightening. So, my daughter says, whatever she's going on, she goes, Mom, if you type it in and you go to WebMD, you think you're going to die in a minute and a half, and you have a sore throat, and you're just
you go to WebMD and you think you have cancer all over your body.
Yeah.
It always leads to cancer
Yeah.
on WebMD, because I'm a true victim of that. I said that to Chris. I think I said this the other day. I was like, I have a headache. Every time I have a headache, I think I have cancer all over my body. Because it's just.
Physician, and of course his patients will come in and say, well, you know what I saw on.
Yeah.
I know.
Yeah.
Why don't you tell me what you found?
Right.
I know,
You
I
just
know.
you kind of auto-diagnose yourself. You
Yeah.
go on your phone, you sit on your phone for 2 seconds, you're like, okay,
Self-diagnose.
headache, and all of a sudden all these diseases and all these things start popping up, And again, that's why I always say the best form is to talk to your physician,
Yeah.
Keep that open relationship with your physician. Really, really trust your physician. Find somebody that you really do trust is the, the key importance of it.
And I'm just sorry that he didn't
Yeah.
get the kind of care that he should have, initially, because that's really, kind of the saddest thing about what you're saying, is that, he had felt it previously and was misdiagnosed,
years,
probably
yeah.
because he was young and they didn't really, they weren't looking.
Don't you feel that you would have to always get a second opinion? Because my mother passed from colorectal cancer.
Say that too sometimes. I think I said that last night. I know women that can go second and third opinions. That's fine. If you have a diagnosis or, absolutely, talk to people. Go for another opinion. That's what you have to do. Then you can make a decision based on what's right for you. But it's too bad, because if they told her she had hemorrhage, she probably had bleeding. And that, you know, a colonoscopy would have probably shown her doctor what was going on if they'd have looked. Even though, you know, sometimes they don't see everything, which, you know, you were lucky. But in general, a colonoscopy is really, you know, they found to be very good at, you know, looking and diagnosing earlier stage colorectal cancer. So and that's what I hate to hear about late stage. I hate that, because that's part of our job, is to talk to people about screening, and we have the screening. You missed the part where we said, but we're with the Cancer Services.
again.
I will. We're with the Cancer Services Program, and it pays for screening for people who are uninsured for breast, cervical, and colorectal cancer if they fall into the certain age and eligibility guidelines. And, you know, do you know how many people are out there that don't know about us? And we're always trying to tell people about this program so that if they are uninsured, that they'll at least call us, and we can either, maybe we can't help them because they're too young or they, whatever, but we can always try to guide them and get them, you know, maybe somewhere where they can get some help. But, you know, it's a sin that we, you know, we're here and this program's been around for over 20 years, that I know.
And also, I just want to also include that with this program as well, you know, people think because of their immigration status, you know, it does not matter, your immigration status in this country, in this state, in this county, in this town. You know, if you came yesterday or if you came 20 years ago, it does not matter. It pays for everything, you know,
we don't
for
ask.
all your screening. You know, when I do my screening intake, as I call it, I don't ask you for any documentation at all. All I ask of you is just a photo ID and a proof of address that states that you live in New York State.
Where's your office?
We're located out of Nassau University Medical Center. We're in the mammography department, but we have health centers all throughout Nassau County. So if you were to need follow-up, you know, as far as coming back for another mammography, or you know, if this FIT kit comes back positive and you needed to get the gastroenterologist appointment, I would make that appointment right away for you. You know, our nurse would go and meet you there and talk to you and explain how to do the prep. So there's a lot of also support on our end, you know, to help patients. So we have health centers in Hempstead on 135 Main Street. We also have a health center on Nassau Road in Roosevelt Freeport. We have a health center in Elmont on Hempstead Turnpike, right diagonally across the street from Belmont Racetrack. And we also have, I'm missing one, in Newcastle, Westbury, where we were yesterday on Union, the intersection of Union. So we are there, you know, and it frustrates me also to see that patients are scared to get the health care that they deserve and that they need because they're scared of their immigration status. And this program does nothing with that. They don't care, they don't ask, no questions asked, really. Just, I need a photo. It doesn't matter if it was from your country, you know, I just need a photo ID to prove that it's you. That's it. You had a question?
Are you the only hospital that's participating, or are there other hospitals?
No, we have South Nassau Community. We have also Glen Cove on the North Shore. We have North Shore LIJ in Lake Success. And then that's it, right? Yeah, so those four of the biggest hospitals, basically, is how I say it, in Nassau County, that really work all together to provide this. And then we have our, just because this gentleman missed it, we also have our mobile van that goes out into the community to do mammography, that has a nurse on board to perform a clinical breast exam.
Do men get mammography?
I'm sorry?
Yes,
Men.
sometimes.
Yes, sometimes, yes.
But they're diagnostic, they're not screening.
Right. So on the van, it's just basic, simple screening mammographies. If you're not experiencing any pain, you know, just simple. You're in. The nurse will do a clinical breast exam on you. We also have the technician on board that would do the mammography on the van. And then at the end of the day, the van goes back to Nassau University Medical Center, and it gets hooked to a machine that basically sends all the films right back to where we are in our you know, digital mammography center, and then the radiologist would read it there, and you know, check for the images to see if there's been any changes in recent years, and I'll just be a little, repeat. That's why I always ask when women come in to get a mammography, if you've had a mammography somewhere else, to bring your priors, and even it goes anywhere. If you go from us to another place, ask for your priors. Take your priors with you, because that is part of your own medical records, and it's the key ingredient for radiologists to determine, changes in your breasts and tissues, and to see if there's been any change.
It's the Nassau Cancer Screening Program, and we're located at Nassau University Medical Center in East Meadow. And my name is Chris Mancuso. I'm the program director.
And I'm Eva Cesare, and I am the patient navigator outreach coordinator for the Cancer Services Program.